Coming up, what you need to know about osteoporosis and the treatments to fight it.
The Disney Institute, today's traveling around destination, has a lot more than just theme parks. There's something to do for everyone.
And making sure you don't get burned. Fire safety tips that could help save your life. All this and more is next on Time for Living. I'm Howard Nelson.
And I'm Janet Jagali, and welcome to Time for Living. Today we take a serious look at osteoporosis and what methods of prevention and treatment are available. We'll even meet some people who are dealing with the disease and winning.
And we'll show you how to protect yourself from a potential fire before it gets started, by making your home a safe one.
And we'll take you to a place offering everything you could possibly want in a vacation.
When it comes to diseases, osteoporosis, the weakening of the bones, can create extremely difficult conditions. Victims are susceptible to hip fractures and broken bones that can occur without notice, making simple daily activities become arduous and painful.
However, recent medical progress is increasing hope when it comes to treatment and prevention. As you'll see in today's lead story, those with osteoporosis or its potential victims are finding ways to make life more enjoyable.
These women have reached an age filled with new opportunities, new choices, a new independence. Like you, they may be freer than ever to enjoy life. But for many women past menopause, this independence may be threatened by osteoporosis, which can lead to a weakening of the bones over time, so that women may become susceptible to sudden and painful fractures. Osteoporosis is the most common degenerative disease among women today. Symptoms can develop often without warning in any woman who has been through menopause. But now there's good reason for hope. Medical science is discovering new diagnostic and treatment options that can help women with osteoporosis preserve their strength and independence.
This time of our lives, we can go do whatever we want to do. And coming into our daughters to have dinner, that's a lovely thing to do. We're very fortunate.
Most of the time, it's a full table. And if we're lucky, Mom and Dad will come and eat with us too. Osteoporosis is no longer that little lady that I used to see walking down all stooped over. Now it's my mother, it's myself, it's, I hope not, my daughter.
We recognize that osteoporosis is, in fact, a disease that we can diagnose, and we do have effective treatments for many women who have post-menopausal osteoporosis. There is no longer any reason for a physician or a patient to feel that this is a hopeless situation.
It's a great relief to know that my daughters and granddaughters can benefit from whatever research shows and develops.
From the time we are born until our mid-30s, our bones become stronger and more dense. The spine is straight, the skeleton seems solid. Yet, if you were able to look inside your bones, you could see what only this microscopic view can show us, the complicated latticework of struts that make up healthy bone material. At menopause, lower estrogen levels cause us to lose bone faster than it can be replaced, so there is a drop in your bone density or thickness. For many postmenopausal women, the bone loss is severe enough to make their bones weak and fragile. The once healthy bone material is now considerably thinner, pitted, and brittle. This is osteoporosis. What's unfortunate is that it's a silent process. It's a silent disease, so you can have it for many, many years and yet not know it. It's important to identify whether you have osteoporosis much earlier than that.
My doctor, my internist, told me 8 years ago that I was becoming osteoporotic. I had no idea what the term meant. And it took me at least 3 or 4 months of reading, asking questions, before I realized that actually I did have osteoporosis.
Spent the morning with
I'm very fortunate in the internist that I have. He's very conscientious about taking care of every aspect of my problems.
There may be no symptoms that a woman herself may recognize in terms of how she feels or how she looks. We must change this outdated notion that this is simply an inevitable consequence of aging for women.
I was told not to lift plastic bags, to always carry paper bags in my arms. I got busy one time with a whole bunch of groceries to come in. I heard this finger snap, and then 2 weeks later, I did the same thing, and I heard this one crack. My grandchildren are very important to me, and being able to care for them is very important. If I were to have a severe fracture, it would really limit my lifestyle and the way I could interact with my grandchildren. I have not allowed osteoporosis to slow me, and I'm just determined that I'm going to stay a healthy, viable person.
I was a senior high school English teacher for 15 years, and when I first found out that I had advanced osteoporosis, I was not really aware of the significance that that would have in my life.
I think what postmenopausal women need to do is first and foremost recognize that they are at risk for osteoporosis.
People who have osteoporosis are old women with white hair, and they're all bent over, and their necks stick out, and that wasn't me. It's had a tremendous impact on every aspect of my personal and my professional life. My hips and my ribs are now just about touching one another, so clothes are just about impossible to find.
There are a number of risk factors for osteoporosis, perhaps the most important one being the postmenopausal status of a woman. Race is also important. Caucasian women, Asian women, and Hispanic women have a greater risk for osteoporosis than do African American women. A family history of osteoporosis is also a red flag. If a woman doesn't have sufficient calcium in her diet, if she doesn't exercise regularly, if she smokes, her risk for osteoporosis is increased.
I have missed over 2 out of the last 3 years of teaching. I miss it tremendously. I miss my students, and my students are missing a good teacher.
As a postmenopausal woman, you should recognize that you are at risk for osteoporosis. You should take the very next opportunity you have and bring this issue up with your physician. The most detailed medical history and the most careful of physical examinations will not tell the physician what the patient's bone mineral density may be. There is only one way to get that information, and that's with a bone mineral density test.
You need to be informed so that you can make the best medical decision for yourself. But you are below the fracture.
When I first found out that I had osteoporosis, of course I first felt, oh my goodness, I'm really old. But then I realized that it's just another process in life, and I plan to fight it.
Rather than considering it an inevitable consequence of aging, we now want to look at this condition as something that we can really do something about.
There's some very basic things that you need to do. You need to get plenty of regular weight-bearing exercise, like brisk walking, for example.
I'm exercising routinely. Just walking on a regular basis is phenomenal. Cross-country skiing is a lot like walking. It's just exhilarating.
You need to be sure you're getting an adequate amount of calcium and vitamin D in your diet.
The food that I eat to try to increase the calcium intake includes things like skim milk and yogurt I have every day.
When you are postmenopausal, it's important to know that taking calcium may help slow down future bone loss, but can't make your bones any stronger after menopause. And always check with your doctor before starting any new exercise regimen. If you have osteoporosis, make sure you ask your doctor about your treatment options.
You have a responsibility to yourself and to the people who love you to stay healthy. And with a few simple questions and some direct answers from your physician, you can find out exactly what you need to do, what your risk for osteoporosis may be, what additional testing you need, if any, and what treatments are available to you now.
Wish me luck.
Good luck.
The improvements in osteoporosis diagnosis and therapy, which have happened in recent years, have changed the way we view this condition from one of hopelessness to one of optimism.
What is giving me hope now, and what has kept me sustained for a while, is knowing that physicians are becoming more educated about osteoporosis.
There is hope, there is medication, there is knowledge, there is my feeling about this, that I can work with it, and I'm going to stay aware of what's happening.
To receive information on osteoporosis bone density testing, call 1-800-498-9933. When we come back, we'll talk with an expert on osteoporosis, so stay with us.
Attention mature travelers. Grand Circle Travel invites you to discover the world in a whole new way. When you call for your copy of the world's best travel values, absolutely free. Inside, you'll discover a completely new way to travel that's planned and paced exclusively for mature travelers. At last, discover the joy of meeting local people in the places you visit and learn about their unique culture and customs and experience their greatest art and architecture. From a picnic in the Swiss Alps to the spice markets of Istanbul, Grand Circle Travel invites you to discover the world in a whole new way. Call for your free copy of the world's best travel values today. To receive complete details on how you can discover the world in a whole new way with Grand Circle Travel, including your free copy of the world's best travel values, call toll-free 1-800-966-2768. That's 1-800-966-2768. Call today.
Welcome back to Time for Living. We're discussing the degenerative disease osteoporosis. And joining me now to discuss medical advances and prevention and treatment for osteoporosis is Dr. Susan Greenspan, Director of the Osteoporosis Prevention and Treatment Center at the Beth Israel Deaconess Medical Center in Boston. Welcome to Time for Living. It's nice to have you here. We know that postmenopausal women are at great risk for osteoporosis. The segment that we just saw discussed at length the risk factors and the cost that this involves. It's immense and it's enormous. But I suppose people need to know how they know if they're at risk and what they can do to determine that information.
I think we're really lucky at this point in time because we do have a very easy, quick test to determine what a person's bone mass is. It's a 1 to 5 minute test. An individual lies down on a comfortable table, a scanner goes over, and in a matter of minutes, the measurement is done and we know, do they have the disease, do they have osteoporosis, or are they at risk?
What are they measuring? What part of your body? Your spine, your hips, your...
We usually measure the spine or the hip, and sometimes both. Mm-hmm. Occasionally we look at the arm, but most of the time the spine and the hip, those are one of the two places that women or men will fracture who have osteoporosis.
So it's not an invasive procedure, it's not painful, it's just 5 minutes of your time.
Exactly.
And this will determine just how extensive the osteoporosis is?
Yes, yes.
And there is something that can be done to begin to try to replace some of that bone loss or to try to prevent some of the negative effects of osteoporosis.
Exactly. We're also very fortunate at this time because something can be done for everybody, from women who are just menopausal to older postmenopausal, even to individuals that have significant osteoporosis. Mm-hmm. There's things that we can do for everybody.
Now, who would be the person to offer this test? Would they call their own personal physician?
They would call their primary care physician. This test is really almost routinely available at most major medical centers. Many private offices now have this test.
Mm-hmm. And once again, just run over the risk factors that are involved. Postmenopausal, number one.
That's the big one. The most common one, postmenopausal, or if a woman's had an early menopause. If she's had a family history, that's a major risk factor for osteoporosis. If she's had a diet low in calcium, if she's had a history of excessive smoking, alcohol intake, too much caffeine, and then there are a group of medications which will predispose individuals to loose bone, and her physician would be aware of that.
I know people are probably saying, and this is probably a redundant question, but to explain early menopause for those who are unaware of it.
Around the time of 50, when an individual starts to lose her periods, that's when they're going into menopause. And when they actually stop their periods, then they've reached menopause. And there are a lot of other side effects that may go along with that.
Now, many people do offset this by, at the time of menopause, begin taking estrogen or estrogen supplements.
Yes.
Do you recommend this as the best avenue to follow?
Well, generally, estrogen has many, many positive benefits, and one of them is to prevent bone loss, to build up that bone and prevent fractures. Estrogen has other benefits for the heart, for the cholesterol, so you get additional benefits in addition to the bones.
But also they can begin to start exercising, as we saw,
Yes.
weight-bearing exercise particularly. And I read somewhere that 7.5 miles of walking a week is all you really need. Doesn't all have to be done at one time.
Well, you need about 30 minutes of brisk, good walking 3 times a week is really the minimum, and then individuals can go up from there. But along with the exercise, as you pointed out, you need to have enough calcium either in your diet or with a supplement. You need to have enough vitamin D.
Because the vitamin D's importance is that this helps absorb the calcium, is that correct?
Exactly. The vitamin D helps you absorb the calcium and make normal bone.
And magnesium, that plays a role in this too.
Magnesium is important for another hormone which also plays into the ability of the body to absorb and hang on to the calcium.
But a doctor can help you with all of this, and once you are eating properly and exercising, doing all the positive things, what are some of the other medications that can be taken?
In addition to estrogen, there's a group of medications called bisphosphonates, which are not hormones, and there's currently one approved for osteoporosis called alendronate or Fosamax. There's another type of medication called calcitonin, which we think of as a bone hormone, and that's also approved for the treatment of postmenopausal.
And that's applied nasally, is that right, the calcitonin?
Yes, that's a nasal spray, 1 inhalation a day.
Is that an expensive medication?
It is relatively expensive compared to hormone replacement therapy.
Now, on the bone density test, is that covered by insurance?
It is covered by most insurance, particularly in the New England area. In certain states, or actually in many states, it is also covered by Medicare, but not in all states.
So someone can determine that by calling their physician and or their insurance company. And would you advise this traditionally for people? Just, I mean, even if there's a question, they should go forward and have the test, because then they can avoid any of the negative things that can occur.
Exactly. It's a very simple, quick test, and with one test they have that information which can really prevent the ravages of this disease.
Let's talk just a second about prevention. If you have, say, young children who are just beginning to mature, what would you advise them to do? What kind of diet, what kind of supplements should they be taking, or should they?
We really recommend for children or even adolescents to have a diet high in calcium or adequate in calcium. So that means to try and get in dairy products such as milk, cheese, ice cream, and to have weight-bearing exercise. Fortunately, most children do have weight-bearing exercise, but we really think that exercise and the calcium in the diet is really the most important.
Is it beyond the age of 30 when you begin to fall apart? Your bones, that is.
After about the age of maybe 25 for women, we slowly start to lose a little bit of bone, 25 to 30, and then it's accelerated around the time of menopause when estrogen is lost.
And how many people are affected by osteoporosis now?
Well, at the age of 50 for a woman, she has a 1 in 2 chance of sustaining an osteoporotic fracture in her lifetime.
And traditionally, where are these most commonly seen? Wrists or hips or
most commonly,
the vertebra?
It's the spine. More than half occur in the spine. In the United States, there are over 1.3 million fractures. There are about 500,000 in the spine, 250,000 in the hip, 250,000 in the forearm, and then the other sites make up the remainder.
Every reason for someone to make certain they know whether they're at risk, and that bone density test would help. I hope people will take advantage of an opportunity to find out more about it.
Yes.
And thank you so much for joining us.
Thank you.
Very interesting. Once again, a reminder, to receive information on osteoporosis bone density testing, you can call 1-800-498-9933. And when we come back, A League of Their Own makes a second effort a lot of fun and very rewarding. So we'll explain. Stay with us.
The fastest growing competitive sport for people over 50 years old is senior softball.
It's the fitness, fun, and friendship that brings the players with the Northern Virginia Senior Softball League out to the ball field twice a week. Their motto, you don't stop playing because you grow old old because you stop playing. Mary Norton has more in this week's Second Effort Salute.
I don't feel a bit different out there now than I did 20 years ago.
Well, I make a play. I'm a hero. I feel like a hero. Guys, out a second.
It's just so much fun. It's invigorating and exciting to play.
Players with the Northern Virginia Senior Softball League must be at least 50 years old to join. That's the age Charlie Turner signed up.
I'm very surprised because some of the guys that are almost 80 years old can still play the game.
Age may be irrelevant, but you can't play this game unless you are in great shape to endure a doubleheader twice a week.
When I get through here, I'll go play 3 sets of tennis, and tonight I'll run 3 miles. I'll do about 900 leg raises, and that's about it. Now I'll cook my dinner and go to bed.
Staying fit is certainly one benefit to playing, but there's a lot more to this game.
Whether it's male bonding or what it is, it really develops a whole new social atmosphere for a lot of people. We have guys like to joke and have a good time, and that's what it's all about.
We need you, baby. With that nice fat there, we need him.
Personally, I think the benefits is the fact that you can come out and play with a good group of guys and at the same time be competitive.
Competition is fierce when a team reaches the tournament level and the chance to win the grand prize.
This is why we go to the tournaments, because we want to win no ring. When we were young, we didn't have a chance. You know, we didn't make it with the Yankees or the Red Sox, whatever it was. And when you're 50, you can begin again.
I'm Mary Norton reporting.
Now, ladies, in addition to all male leagues, there are women's softball and co-ed leagues with teams of varying skill levels.
And to inquire about leagues in your area, contact the International Senior Softball Association at 703-368-1188.
When we come back, another side of Disney that could make your vacation everything you want it to be, so stay with us.
Oftentimes we take a vacation for rest and relaxation. Other times we take a vacation for adventure and activities. Well, if you want both or can't make up your mind, don't worry.
We've got a destination just for you. It's the Disney Institute, and Rex Traylor takes us there in today's Traveling Around destination.
Located on the grounds of Walt Disney World Resort in Central Florida, the Disney Institute may be the closest thing to Fantasy Island. If you've ever wanted to anchor a TV newscast, cook a gourmet meal, or climb a vertical rock wall, you can do it all at the Disney Institute. Quite different from Disney's other attractions, the Disney Institute offers guests a chance to experience over 60 different programs.
I need an anchor person on front of the desk right now. I need 6 people in the control room now.
One of the most popular activities, the TV studios. Guests operate the cameras, write the scripts, and deliver the news from a state-of-the-art television facility.
More news in 1 hour from the Magic Mix, WALT.
TV's not your game? How about being a disc jockey on WALT radio?
Headline news this hour.
You can spin those platters that matter on the closed-circuit radio station. And guests can choose from more than 3,000 songs from 5 different formats.
That's the exact process they do at feature animation when they're doing it.
Have you always been fascinated by cartoon animation? At the Disney Institute, you can learn the magical process of bringing drawings to life. Experts in the field give you step-by-step instructions on how to do it. Who knows? Maybe you'll be the next Walt Disney. Many of the older guests enjoy the culinary programs at the Disney Institute. Guests learn from world-class chefs in high-tech kitchens. They have enough cookware for 125 average kitchens, including 308 pots and pans, 1,200 knives, and 125 rolling pins.
At the baking class this morning, each person had their own stove, their own oven, their own cooking area, so that we could follow along with the teacher.
That's the flour right there, what you see there.
Want to make your green thumb even greener? Disney Institute offers classes in gardening and landscape design.
Kristen? Yeah? I'm sorry, what's this? It was really fun. They had everything organized. They've obviously done thousands of these. Kristen's had 13 years experience, and she really knew what she was doing. And I just felt like I had a chance to learn from an expert.
The formula is to keep it simple, show people what they can do with objects or materials that they can easily purchase themselves, and let them have a hands-on experience, interactive, where they can actually do it themselves, and be sure that they walk away with something. And as you say, it could be something that's up here that they take a memory away with them, or something that's physical that they can go back to their family or their friends and say, look what I made.
You can also learn about the environment, exploring the flora and fauna of the Central Florida swamplands.
Mostly what it means is getting to show our guests a part of Walt Disney World that they've not been able to see in the past, which is our conservation lands, the areas in which we have a lot of wildlife that is very close geographically to the parks that people have visited for years, but they haven't seen the other side.
If you're all able to really discipline yourself to come forward.
Life sports are also offered at Disney Institute. You can sharpen your golf game,
Not quite as good as he's...
play tennis, or basketball, or you can learn water aerobics. And after learning something new, it's time to pamper yourself. The Disney Institute offers a full-fledged spa, where you can indulge in a seaweed wrap, get a massage, or a French body polish. Guests stay on the grounds of the Disney Institute, in townhouses and bungalows. The Seasons Dining Room offers guests a different dining theme each night. Once you book a stay at the Disney Institute, vacation consultants will work with you to plan your itinerary. You can immerse yourself in one interest area or mix and match programs. Summer camp was never like this.
Well, they certainly cover everything you could possibly want in a vacation.
Yeah, and you could even come home with a new skill.
How about that? When we come back, our financial expert talks about long-term health. The details when Time for Living continues.
Travelin' Around is brought to you by Grand Circle Travel. Attention mature travelers. Grand Circle Travel invites you to discover the world in a whole new way. When you call for your copy of the world's best travel values, absolutely free. Inside, you'll discover a completely new way to travel that's planned and paced exclusively for mature travelers. At last, discover the joy of meeting local people in the places you visit and learn about their unique culture and customs and experience their greatest art and architecture. From a picnic in the Swiss Alps to the spice markets of Istanbul, Grand Circle Travel invites you to discover the world in a whole new way. Call for your free copy of the world's best travel values today. To receive complete details on how you can discover the world in a whole new way with Grand Circle Travel, including your free copy of the world's best travel values, call toll-free 1-800-966-2768. That's 1-800-966-2768. Call today.
Welcome back to Time for Living. Long-term health care is something everybody should consider. However, what type and what resources are available to us may make our decision more difficult.
In today's Health, Finance, and More, financial expert Steve Burke tells us what we need to consider and why we need long-term health care.
Have you ever seen a catastrophe waiting to happen? Sadly, there's one out there for all of us to see. It's those people approaching retirement, in retirement, or with family members in those positions who think Medicare or Medicaid is going to take care of nursing home care if it's necessary in the years ahead. Unfortunately, that is not the way things will work out. Medicare may pay nursing home care if it calls for skilled care, and then only if it's approved. Beyond that, Medicare pays nothing beyond 100 days. So if a person is under care for longer than 3 months, there is no coverage. The other government-connected plan, Medicaid, pays only for people who are poor enough to qualify for financial assistance from the government. Put another way, a person must spend their own money until they have little or no money left. The irony is we live a lot longer than ever before, and that triggers a financial exposure which is unique to our society. And what is the financial exposure? Today it is called long-term care or nursing home experience. It is a strange dichotomy, longer-lived, but as a result, expenses our ancestors rarely had to face because they didn't live to be 70, or amazingly 100. Like it or not, a great many of we experienced citizens will find ourselves in nursing homes or need care at home which few family members will be trained to provide. So comes the question, what are our options? We can fall back on Medicaid, which is a program for those with little or no assets, turn to our kids or other family members or friends, spend the money we have, hoping it will last, or develop a strategy to protect ourselves as well as spouses. In this last instance, we also would be helping our children who otherwise would be expected to somehow pay our long-term care bills. The problem itself is a very straightforward one. If you are unfortunate enough to find yourself in a nursing home, it will cost somewhere in the vicinity of $25,000 per year and up. Needless to say, that type of expense can devastate a retirement plan or assets which have taken a lifetime to build up. The simple solution is as straightforward as the problem. Transfer the risk to an insurance company, but carefully. You should shop for nursing home care. Don't just buy the first policy that is offered. The first policy may be the best one, but take the time to compare. 3 companies are a fair sampling, but you can look at more if you like. Try to make a comparison chart for yourself which highlights those points which are important to you. As examples, you should compare the premiums, of course, but also, are there any surcharges for different premium schedules? Can the premiums be changed without your permission? Is the policy guaranteed renewable? What type of elimination periods are available? Do they reduce the cost appreciably? Are mental disorders such as Alzheimer's covered? Will there be coverage if you stay in your own or family member's home? Can family members or friends be compensated for taking care of you at home? Do pre-existing conditions eliminate or reduce coverage? Are all levels of care included in the plan? Skilled, intermediate, custodial? Are there reductions in the premium if you and your spouse purchase the same type of coverage? The most important question is, what are the exclusions? Finally, do not feel compelled to insure for the total amount of what you anticipate nursing home care will cost. As an example, if you feel that $25,000 per year will cover the bill at the nursing home of your choice, review that income which you may presently have from a pension plan, Social Security, or income from investments. Unless you need the income for a spouse or other financial commitments, It's sensible to subtract that income from the annual bill of the nursing home. $12,000 per year from Social Security could be applied to the $25,000 charge of the nursing home. This would mean you need only an additional $13,000 per year from a long-term care policy. This helps keep your premium lower. There are answers out there, and you have the talent to find them. This is Steve Burke, Time for Living.
If you have any financial questions about topics you've seen on Health, Finance, and More, you can write to us at Time for Living, care of Health, Finance, and More, P.O. Box 8452, Boston, Massachusetts, 02114.
Or you can fax us at 617-329-1774 or call our voicemail and ask your questions. Our voicemail phone number is 800-232-7213.
When Time for Living continues, how to make sure your home is fire safe. Some tips when we come back. As more people live in their homes longer and accumulate more stuff, it's important for them to be aware of fire hazards.
And currently, there is a new effort to inform people how they can make their home fire safe. Mary Norton explains.
Hi, how are you? I'm Farron Taylor. How are you today?
Nice to meet you. Please come in.
First thing we'll talk about in your home is some kitchen fire safety tips.
The kitchen is the #1 place in a home where fires can start.
For your own safety, when you're cooking on the stove, try to wear tight-fitting clothing. Loose sleeves, loose clothing can easily be ignited by an open burner.
Also, it's important to make sure that pot handles are turned inward so they can't be hit and knocked off the stove.
One of the things that we find affects senior citizens, affects everyone, cooking fires in the home continue to be a major problem. The problems with careless smoking in the home continue to kill thousands of citizens every year. Let's talk a bit about fire safety in your laundry room. A big problem with dryers is the buildup of lint. One thing that you should do at least once a year, or more often if you find that it's building up, is to remove the lint from the hose in the back of the dryer. It's very combustible. Simply take the hose off the back and clean it out. Over time, if lint is built up, it can make the dryer work harder and harder to the point where it can actually ignite the lint, catch fire to the clothing inside, and spread from the dryer throughout the rest of your home.
To help educate people of these dangers, AARP, along with the Consumer Product Safety Commission and the National Association of Fire Marshals, published this booklet with safety tips to help you remain safe in your home.
Well, one of the things we want to accomplish through this brochure is to get people to think about and be aware of the importance of smoke detectors and their ability to remain safe in their homes from fires especially.
Checking your smoke detectors monthly should be the first thing on your safety checklist.
Why don't you show me how you test your detector?
Often people use their furnace rooms for storage.
Combustible items such as this plywood, or your storage, the paperboard cartons with combustible storage. It's important to keep them 3 feet away from heat-producing appliances.
When the grandchildren come to visit, you have to be especially careful to keep matches and lighters out of their reach. Also, if you do have disposable lighters, make sure that they are child-resistant. And if there is a fire, first get out of the house and then call 911.
Talk about a little fire safety in your living room. We talked about the number one place that fires start in the home or in the kitchen, but the number one place in the home where a fatal fire can start is between the living room and the bedroom area. Overstuffed furniture can be a problem when combined with careless smoking. Don't be tempted to empty ashtrays immediately after they're finished being used. Let them sit overnight and cool.
And remember, it's easier to prevent a fire than it is to put one out. I'm Mary Norton reporting.
To receive your free brochure titled Fire Safety Checklist for Older Consumers, write to AARP Fulfillment, 601 E Street, Northwest, Washington, D.C., 20049. Falls or fear of falling limits the lifestyle of up to one-third of community-dwelling older adults. Falls are the most common cause of accidents of people over the age of 65.
Now, falls are responsible for multiple soft tissue injuries, hip fractures, wrist fractures, brain injury, and burns. And falls contribute to the development of blood clots, dehydration, pneumonias, and other serious medical conditions. Now, while most falls do not end in death, they are not benign events. Dr. Alan Abrams has more in this week's Medical Minute.
Falling should never be viewed as an accident attributable to a person's age. Falling and gait instability are signals that a person is at risk for a decline in function and independence. Many people experience a fear of falling that leads to the avoidance of activities which they are perfectly capable of performing, thus limiting their enjoyment and experience of life. There are many things that you can do, along with the help of your primary care provider, to minimize the chances that you will fall. Here are some of the risk factors for you to keep on top of. Vision. Many deficits in visual acuity may be modified with proper attention. Please check your visual acuity regularly and seek medical attention if you notice a change in visual perception. Hearing. Hearing loss can precipitate a fall when an individual is unable to hear the warning sounds of something approaching. This hearing loss could be due to something as simple as excessive wax accumulation. See your primary care physician if you or anyone close to you has noticed a change in your hearing. Postural hypotension. If you notice that when you get up quickly you feel dizzy, or that shortly after taking a few steps you feel unstable, ask your physician to evaluate you for postural hypotension. In some people, as they get older, their blood pressure drops momentarily as they quickly change position. This can lead to dizziness and falls. Musculoskeletal conditioning. The steadiness of our gait and our ability to right ourselves is dependent upon an intact neurologic and muscular system. Any weakness or pain which impairs our ability to right ourselves can have devastating consequences. No matter what your medical condition, maintain the highest physical fitness that you can. Consult your physician to authorize a personal program of strength maintenance that is tailored to you. Take good care of your feet. For many, ignoring foot problems and wearing unsafe footwear can trip you up all by itself. Medications. Older adults who are receiving drug therapy fall more often than those who are not. Ask your physician to review your medication regimen regularly and only take those medications which are absolutely necessary. Drugs which are used to treat anxiety, pain, and headaches, along with some for fluid retention and high blood pressure, have been particularly problematic, promoting falls. Psychological factors. Never overestimate your ability to perform activities. Maintaining an image of independence and refusing to use assistive devices when needed will increase the chances of becoming disabled. Emotional upheavals can render you less attentive to environmental hazards. Keep your cool. Most falls occur in the home. Many communities have professionals who will evaluate you at home for environmental safety. In particular, be aware of the following: highly polished wax floors, loose rugs, or thick piled carpets. Excessive glare or inadequate illumination. Lack of handrails on stairs, high steps, or worn stair treads. Slippery bathroom floors, showers, or bathtubs, and excessively low toilet seats. Inappropriately high or low shelving. These are among the many home hazards which can be corrected and reduce your risk of falls. Staying upright is no easy task. Many factors, medical, psychological, and environmental, influence our ability to stand safely erect. Be curious if your vision or hearing has changed. Notice if medications affect your sense of stability. Consult with your physician for a comprehensive falls evaluation if you feel unsteady on your feet. Reassure yourself that you can get from here to there safely and make your later years a time for living. This is Dr. Alan Abrams with your Medical Minute.
If you have any health questions about topics you've seen on Dr. Alan Abrams' Medical Minute, you can write to us at Time for Living, care of Medical Minute, P.O. Box 8452, Boston, Massachusetts, 02114.
Or you can fax us at 617-329-1774 or call our voicemail and leave a message. Our voicemail phone number is 800-232-7213.
We'll have more Time for Living when we come back. Get your pens and pencils ready. We'll have our address one more time when we come back. Stay with us.
We thank all of you for watching Time for Living, and we hope you continue to get the information you need. Before we say goodbye, we'd like to give you our address and phone numbers one more time. It's Time for Living, P.O. Box 8452, Boston, Massachusetts, 02114.
Or you can call us on our voicemail number at 1-800-232-7213, or fax us at 617-329-1774. Remember, this show is not only for you, it is about you. We hope you enjoyed today's show, and we look forward to seeing you next week. We'll certainly have more interesting people and places to introduce you to.
We'll see you next week, and until then, remember,
it's time for living.
Take care.
Bye now.